To my channel Innovate, we will going to discuss about the anatomy of the elbow joint. The elbow joint, that is the strongest joint of the arm, is present between the humerus, that is the bone of the upper limb, including the arm, and the radius and the ulna, that is present in the lower part of the upper limb, that we call as the forearm. So now we're going to discuss the articulating processes and the joint capsule that will be formed between the radio or the humero-ulnar joint, that we also call as the elbow joint. Now coming to the articulation that are provided in the elbow joint is from the trochlea of the humerus. The humerus that we have discussed in a separate video, having a trochlear surface that articulate with the notch of the ulna, while the other articulation is provided from the capitate of the humerus with the head of the radius. The radius and the ulna that we have discussed in a separate video of the bony attachments, so you should have to watch that video to understand the complete anatomy of the elbow joint. So this humerus with the ulna called as the humero-ulnar articulation, while that of the humerus when articulate with the radius head is called as the humero-radial articulation. So these both articulations ultimately forms the elbow joint. Now we're going to discuss about the ligaments that are attaching and strengthening the elbow joint. There are two classes of ligament, including the lateral collateral ligament and the ulnar collateral ligament. The collateral word suggests that they are present laterally and on the both sides. If the radial is present on the radial side, that we call as the lateral side, while that of the ulna is present on the medial side of the elbow. Now here you can see there is a presence of a lateral radial or the radial collateral ligament having the attachment with the annular ligament, and this radial collateral ligament is attached from the epicondyle of the humerus on the radial side and with the head of the radius. When these two joints articulate, there is a presence of a ligament that strengthens the lateral part of the humeroradial articulation. The second ligament that we call is broadly the ulnar collateral ligament is present on the medial side, and it is going to attach the medial epicondyle of the humerus with the head of the ulna, or you can say the trochlear notch of the ulna is articulated with the humerus, and this part is strengthened by the ulnar collateral ligament. So this ligament having three parts, including the anterior band, the posterior band, and the oblique band, if we see it more structurally. So these three bands combine to form the ulnar collateral ligament that is providing the attachment to the humero-ulnar articulating part of the elbow joint. This elbow joint is strengthened by these two collateral ligaments. Now coming to the movements of the elbow joint, there are two parts of movement. According to the movement, we divide the elbow joint into a hinge type of synovial joint. The hinge type of synovial joint that provide movement in a one plane, and this type of synovial joint we have discussed in a separate video of synovial joint. So this synovial joint will going to provide two movement, including the flexion and the extension. The flexion is provided by some muscles that are called as the chief flexors of the forearm, that we call as the bicep brachii and the brachialis muscle, that are the chief flexors of the forearm. Then coming to the extension. The extension is provided by the chief extensor of the forearm, that we include the triceps, and is assisted by the small muscle that we call as the anconeus. So how this flexion and extension occur, we will going to see by a diagram. Now here you can see it is shown an example of flexion that is provided by the brachialis and the bicep brachii, and this is an extension of an elbow joint provided by the tricep brachii and assisted by the anconeus. Now coming to the blood supply that is provided on the elbow joint is from the anastomosis around the elbow joint. The anastomosis is formed from the arteries that include the superior and the inferior ulnar collateral arteries. These ulnar collaterals, when anastomosed or articulate with the anterior ulnar recurrent and the posterior ulnar recurrent artery, they will cause to provide an anastomosis around the elbow joint and give a major blood supply to the elbow joint and the muscles that are providing the movement of the elbow joint. Now here you can see the anastomosis around the elbow joint is provided from the major arteries, branches of the brachial artery. So thank you for watching. Subscribe for more.